University Department of Sociology. Haley works with adult domestic violence survivors when seeking safety within abusive relationships, reporting abuse in the criminal legal system, seeking a divorce from their perpetrators, and establishing financial stability when leaving abusive relationships. Before working at JFSA, she volunteered as a hotline advocate on the Cleveland Rape Crisis Center hotline and worked in the Case LGBT Center, organizing LGBT-specific Sexual Assault Awareness Month events. Haley specializes in the research and response to the gender-based violence within the LGBTQIA+ community. After we have Haley, we'll have Carrie Joseph. Carrie Joseph currently serves as the Prevention, Education, and Inclusion Manager for the Domestic Violence and Child Advocacy Center. Carrie has over 20 years of experience working with at-risk children, child abuse, domestic violence, and mental health issues. In addition to overseeing projects to support underserved and marginalized communities, Carrie provides prevention services and education in the community. Her work includes early intervention programming for young children, healthy parenting programs, and facilitating domestic violence education groups for victims, as well as workshops for professionals, mandated reporters, and even caretakers. Carrie is a graduate of the University of Akron with degrees in criminal justice and social work. She is a trainer for the Perpetration Prevention Program curricula developed by the Kemp Institute in Denver, Colorado. Carrie is also a certified facilitator for the ACT Raising Safe Kids Parenting Program developed by the American Psychological Association. She has a certification in mental health first aid and a chemical dependency counselor assistant. As follows, we'll have Dr. Dana Prince, who is an assistant professor at the Jack Joseph and Morton Mandel School of Applied Sciences at the Case Western Reserve University. She holds a bachelor's in Women and Gender Studies from Oberlin College, a master's of public health from the University of Pennsylvania, and a PhD in social welfare from the University of Washington. Dr. Prince completed her NEDA-funded T32 postdoctoral fellowship focused on substance abuse prevention at the Yale School of Medicine in 2016. She has developed a robust program of the health disparities research that focuses on the transitioning to adulthood for vulnerable, marginalized youth, most notably substance use, incarceration, and homelessness among adolescents and young adults transitioning from foster care. Dr. Prince is actively engaged in community and system-based research to impact services and outcomes for sexual and gender minority youth in foster care who face additional risk. She serves as a faculty associate at the Schubert Center for Child Studies. Our last panelist will be Alexandria M. Bruden, who is a senior attorney at the Legal Aid Society of Cleveland, specializing in domestic violence representation. She serves on the Advisory Committee of Domestic Violence and the Subcommittee on Abuse, Neglect, and Dependency of the Supreme Court of Ohio. Alexandria is also a board member of the Criminal Justice Services Family Violence Prevention Center Advisory Council Board and on the Cuyahoga County Domestic Violence Shelter Advisory Board. She is a Violence Against Women Act Implementation Committee member and serves on their Grant Allocations Committee. Alexandria is also a statewide and national lecturer and trainer on dynamics of domestic violence and the law, a consultant to various legislators and other professionals to Ohio domestic violence law and legislation. Finally, she is the co-author of Ohio Domestic Law for Thomason Publishing Company with Judge Ronald Adrian and Judge Sherry Midday. Let's give a warm welcome to our first panelist, who is going to be Haley Yoakum.
So hello, so I am going to jump right in. So the legal definition of domestic violence. So the legal definition of domestic violence is when a family, household member, or someone with whom you're in a dating relationship does one of the following: attempts to cause or recklessly cause bodily injury, by threat of force, puts you in fear of immediate serious physical harm, menacing by stalking, aggravated trespassing, commits abuse to a child that harms or threatens to harm the child's health or welfare, and that includes both mental or physical child abuse and neglect, or commits a sexually oriented offense. So when looking over the legal definition, I want to note that this definition of domestic violence, it includes physical and sexual abuse, as well as child abuse and neglect. And kind of expanding on this definition, at JFSA, Jewish Family Service Association, we work with adult survivors of intimate partner violence. And intimate partner violence is a type of domestic violence. So how advocates think of intimate partner violence is that it is a repeated pattern of behavior an abuser uses to gain power and control over the victim. So different ways that intimate partner violence can be perpetrated is through emotional abuse, sexual abuse, physical, verbal, financial, technological, and spiritual abuse. Intimate partner violence is ongoing, and it usually escalates over time. And what I mean by it usually escalates over time is that it becomes more dangerous and it becomes more lethal over time. Intimate partner violence occurs in familial and/or intimate relationships. So this can be intimate relationships where the people are living separately in the same household, in current relationships, in former relationships. So the social service definition of intimate partner violence moves beyond the legal definition. And with the difference in the legal definition and the social service definition, it's important to note that it is completely legal to say things to make your partner feel worthless and unable to leave the relationship. It is completely legal to isolate your intimate partner from all of their friends. So expanding on the social service definition, IPV, intimate partner violence, is not an issue with anger, communication, substance use, or mental health. It is a power and control issue. No amount of parenting classes, anger management courses, or therapy referrals will safely address the underlying issue that a perpetrator feels entitled to control the thoughts, emotions, and actions of their intimate partner. With all of those definitions being said, why do you all care? We care because intimate partner violence is the most common crime in the US. Intimate partner violence causes more injury every year to cisgender women between the ages of 15 and 44 than all auto accidents, muggings, and cancer deaths combined. Intimate partner violence is experienced regardless of age, race, religion, socioeconomic status, and sexual orientation. Research shows that in the US, around 33% of cisgender women experience intimate partner violence. And again, this statistic cuts across cisgender women of all ages, races, religions, socioeconomic status, and sexual orientations. That being said, I would be remiss to not note that survivors of historically oppressed groups experience heightened rates of intimate partner violence homicide, as well as culturally specific barriers to leaving abusive relationships. An example of this includes that Black, Indigenous, and/or people of color intimate partner violence survivors experience heightened rates of intimate partner violence homicide within intimate partner violence relationships. Further, and my co-presenter, Dr. Dana Prince, will elaborate on this in her portion of the presentation, a transgender survivor may experience identity-specific barriers to leaving an abusive relationship that a cisgender survivor just may never come across. Furthermore, particularly in the context of this presentation, how does intimate partner violence affect children? The answer is horrifically. There is a long-standing myth that as long as a perpetrator of intimate partner violence does not commit child abuse or neglect, being a perpetrator does not interfere with their ability to be a good parent. This is false. We know that 30 to 60% of intimate partner violence perpetrators also abuse the children in their homes. We know that intimate partner violence is a precursor to the death of children in child abuse and neglect cases. Research has found that simply witnessing the abuse of a parent has at least the same level of serious effects as being the target of abuse. These effects can involve increased anxiety and aggression in children, along with health and cognitive issues in children. Further, we understand that intimate partner violence results in the intergenerational transmission of violence. And what I mean by the intergenerational transmission of violence is that a child who observes a parent being abused will absorb that experience in ways that affect their mental and physical health. Children who grow up in homes where intimate partner violence is occurring, or who have a parent that abuses another parent, are more likely to grow up to be in abusive relationships themselves. And this cycle is going to continue until a survivor of intimate partner violence is able to safely escape an abusive relationship and receive the survivor-centered healing that they deserve. So for this reason, it's vital to refer survivors of intimate partner violence to a domestic violence services program. So if you are a service professional who is working with a child who has a parent who is experiencing intimate partner violence, I strongly encourage you to refer the parent to a domestic violence services program. At Jewish Family Service Association, on this screen are some of the services that we provide when working with adult survivors of intimate partner violence. We work with a survivor to safely address the specific needs that they have due to experience in intimate partner violence. This can include legal advocacy to navigate the criminal legal system when reporting abuse, or navigating the civil legal system when seeking a divorce or the custody of their children. And when we are working with survivors who have children, we use the intergenerational advocacy approach. So what is the intergenerational advocacy approach? It's an approach that seeks to meet the needs of the survivor who is working to escape the control of their perpetrator in some way so that that survivor can feel empowered to advocate for their children. How we work to empower a survivor to advocate for their children can take a lot of different forms. It can look like including the needs of the child in the survivor's needs assessment. It can involve educating a survivor about the negative effects intimate partner violence has on the children. And this education can result in a survivor feeling empowered to educate a student's teacher about what's going on at home, so they make sure that the child's needs in the classroom are being met. It can involve working with a survivor to provide a child therapy referral to take the child to in order to ensure that that child's mental health needs are being addressed, and how that child feels about what's going on at home or with their parents is being honored and validated and taken into account. Further, we work to empower a survivor to educate their child in a developmentally appropriate manner about what intimate partner violence is. For example, we can work with a survivor, and then the survivor will tell the child, this is not normal. It's not okay for mommies to treat daddies like this. And finally, working with a survivor to report any instance of child abuse or neglect is a major part of the intergenerational advocacy perspective. Reporting this child abuse or neglect, particularly that child abuse and neglect that is perpetrated by the intimate partner violence perpetrator, can be really, really difficult for a survivor. I'll have clients come into my office terrified and say, I just found out that my perpetrator raped my child. And I will say, I have to report what you just told me. Let's call Child Protective Services together. It's really common for a parent who's just found out that their baby is being abused to have absolutely no idea what to do, particularly when that survivor is scared of experiencing harm from the person that did harm to their baby. And we want that parent to feel actively involved in getting the child the help that they deserve. Furthermore, the intergenerational advocacy perspective involves addressing the specific barriers to fleeing abuse that survivor encounters. So in terms of child custody, this can look like addressing a survivor's fear that if they leave an abusive relationship, they're going to lose their children. Survivors fear that they will lose their children for a variety of reasons. One being that they are scared that they're going to be blamed for perpetrator's abuse. They're scared that they're going to get asked, why didn't you do a better job of protecting your kids? Why didn't you leave earlier? Do you not care about your children? Survivors often fear that if they flee abuse with their children, they'll be accused of kidnapping. They fear that if they leave their abuser will have unsupervised access to their children. And it's very important to note that it is the legal norm for perpetrators to have unsupervised access to their children. And this is something that Alexandria Rudin is going to go over in her part of the presentation. As an advocate, I work with survivors to address all of these fears by providing as much education as possible about what the survivor's legal options are and what to expect when engaging with the legal system as a survivor of intimate partner violence. We work to connect clients with legal counsel. When a client does lose custody of their children, we provide support. Another barrier to leaving an abusive relationship that the intergenerational advocacy approach seeks to address is the risk of more violence. Unfortunately, the risk of intimate partner violence homicide is most likely to occur when a perpetrator senses the end of the relationship. This is because intimate partner violence is an issue with power and control. And to a perpetrator, a victim leaving the relationship is the ultimate loss of power and control. Another form of violence that survivors actively fear will escalate when leaving an abusive relationship is child abuse. It's very common for perpetrators to threaten to commit child abuse or to make things absolutely miserable for the children if the victim leaves. And in response to the increased risk of homicide when a survivor attempts to leave an abusive relationship, victim advocates safety plan. Safety planning is a very approachable way of saying homicide prevention. Within the intergenerational advocacy approach, safety planning involves safety planning with the survivor for the safety of both the survivor and for the survivor's children. If age appropriate, this can mean preparing a survivor to speak to their children to create a safety plan. So, for example, having code words. When I say bracelet, go to the neighbor's house and tell them to call the police. Such safety plans can address what a child should do when abuse is occurring. It can address what a child should do during custody exchange between parents. So when dad comes to pick you up, we're going to wait on the front porch, and then mommy is going to go inside while you walk to the car. Such safety plans involve a survivor teaching a child to not interfere in arguments. And safety planning can involve emotional safety planning. So emotional safety planning involves either a survivor or a child having a plan to cope and get through instances of abuse, particularly when in COVID-19, when there are even more financial barriers to leaving an abusive relationship, such as limited access to shelter, lack of financial resources to be able to establish a new home. It's vital to provide a survivor coping mechanisms to survive abuse when it's just not an option to leave. So for when a child, for example, for when a child has visitation with a perpetrator, this can involve saying, you're going to be at mom's house this weekend. Let's talk about what to do when things get tough. I've seen survivors have their child paint their nails in a way that matches the survivor and tell the child, whenever things get bad, look at your nail color and remember that mommy's here and that you're not alone. So with all of this information, what do we do? And among what my co-presenters suggest, these are my suggestions. First of all, become educated about the common tactics of perpetrators. I suggest reading Why Does He Do That? Inside the Minds of Angry and Controlling Men by Lindy Bancroft. This book is written by a battering intervention counselor for victims of intimate partner violence to be able to read and better understand their experience of abuse. As a professional who works with children, understanding common ways perpetrators seek to take power and control over the victims is vital to recognizing when a child has a parent who is experiencing intimate partner violence. Further, if you know a child who may have a parent experiencing intimate partner violence, safely refer the survivor to a domestic violence victim advocate. On the screen is the information for how to access Jewish Family Service Association's domestic violence services. Additionally, a flyer is going to be sent out after this presentation that has all of the intake information. So with that, I'm going to pass the baton on to Carrie Joseph from the Domestic Violence and Child Advocacy Center to just expand on children's exposure to intimate partner violence and the best practice interventions for children.
Okay, good morning, everyone. So as Haley as shared, I am going to talk a bit more about children, focus a little more on children, although, you know, we know that domestic violence is a big part of, well, it is the reason why we're having this discussion around how it impacts children, and how it's also become a little more challenging with the COVID issues that we're dealing with right now. So if we could go to the next slide. So we've heard some statistics, but just a few more just to really help us understand and put this in perspective of how this problem really looks. We know that about 3.5 million reports of maltreatment are made to protective services throughout the country every year. So as we know, child abuse often goes hand in hand with domestic violence. The children become part of the situation, not always physically, but we know it can be emotionally. So we know that that's 3 to 4 million children between the ages of 3 to 17 that are at risk to exposure to domestic violence. And in this particular survey of 6,000 American families, they said that 50% of the homes where men were assaulted, where they assaulted their female partner, they also abused the children. Next slide, please. So again, to give us a bigger picture, a better picture, according to Defending Childhood, in the US, 46 million kids experience trauma. So that is the population of Florida, New York, and Wisconsin combined. So that helps us see the range of this problem that we're dealing with in the children. And many of us are working amongst these children, sometimes not able to recognize, we're not recognizing, we see behaviors, but we don't know where these behaviors are coming from. So we're just gonna take a little more in-depth look about how these behaviors and why these behaviors come about. So now that we're all learning to adjust and deal with the things that have come along with the COVID-19, we know that we're all kind of learning to live our new normal. So in homes where domestic violence is, or intimate partner violence is present with children, we know that there's an increased stress levels. We have families who their finances have been impacted. There's been loss of jobs. There's been a plethora of things that have changed. You know, now parents are the teachers. So with that comes a lot of extra stress. So we already have homes that are already stressed, that may be dealing with intimate partner violence. And now the children are in the home, less to do, less activities. We have limited resources now and activities for the children. You know, if prior to COVID, if they didn't have a bicycle, you can't really go and find a bicycle now. So it's very limited on things for them to do. If they didn't already have it, they probably can't get it, unfortunately. Even swimming is restricted. So summer activities are restricted. Things aren't there. So children are in the home more with, unfortunately, less to do. And we also see the impact on the accessibility support systems. When children were in school, when we had more things to do, they were more active, they had more contact with natural support systems. And a lot of that is through the school system. Children become familiar with their teachers and other individuals, personnel in the school, and they find those people that they are comfortable with, and they attract to sometimes not necessarily share, but just be able to talk about things that they have going on. So that too has been limited. So there's less opportunities for those conversations. And sometimes kids don't come out and talk about what's going on, but they have a way of protecting themselves, and they can create those conversations or craft those conversations with individuals without saying that this is a problem in my house. But now, because of the isolation, that we're all dealing with, they don't have these opportunities to talk to folks and share and kind of validate what they have going on. Next slide, please. So when we think about childhood trauma, just again, to put things in perspective, we look at it as a scary, dangerous, violent, or life-threatening event that happens to a child. And we want to keep in mind that this can be one single event that happens to a child or a repeated pattern of events. So for some children, if we think about it as adults, we all have that friend that maybe as a child had a bad experience with a dog. And now they don't deal with dogs, but maybe we had that same experience and it didn't impact us in that same way. So children, you know, it's going to look different for each child. Children will receive things differently. So it's not a one size fits all when it comes to trauma. And again, it can be a repeated pattern of events. I think of a situation that I think helps explain this a bit is when my daughter was 7, she was, we were driving, and of course, trying to be a good mom, I was sitting at a red light and texting, and I put the phone down and thought it was time to go, but it wasn't. So I hit the car in front of me, but it was just a bump. But my 7-year-old in the car, it scared her. Nothing like that had ever happened before. So as we're in the car on future trips, every time it was time for me to hit the brake, she started holding the seat. Mom, mom, mom. And at first it started to, you know, I was aggravated, but then I realized that impacted her. And so we had to work our way through it. So it was like that for about 7 months afterwards. So, you know, for some kids, it doesn't have an impact, but for her, for other children, when things happen, that's a scary event, they respond to it and they learn to adapt to it. For her, it was warning me, it's time to slow down. So kids will find a way to adapt to their situation when there's something that has, you know, created a trauma effect for them. Next slide, please. So when we think about intimate partner violence and children being exposed, a lot of times parents believe they can hide what's happening to them. So, you know, here's where we start to see some mixed messages go across to children because 80% of them hear things. They hear the yelling and the screaming. They may not be in the same room, but they can hear it. The aftermath, they see the bruises or other injuries. They might see broken furniture in the home or destruction after the incident. So, you know, depending on, you know, the situation, they're going to see or hear things, or they might be present. And some children will even try to intervene, which becomes a dangerous thing. But it's hard for some children, especially younger children, to sit and watch somebody they love be hurt. So they want to try to do something. They want to try to stop the situation. So now we have them getting involved. But their involvement will, you know, range. Again, some children won't do anything. Some children are exposed to it so much, it becomes very normal. They could be in the next room watching TV. They won't flinch because it's become the norm in their household. Other children, again, will try to intervene. So, for children, it can go from not really understanding to what's taking place to them actually having to help apply first aid after an event occurs. So it can look very different for all children. But again, sometimes we see those mixed messages because sometimes, you know, when children ask, what happened? Are you okay? Oh, it's fine. We were trying to discuss things, but you know, we love each other. So it kind of sends that mixed message for children because we love each other, but we're hurting each other. So that's where children start to learn to manage things on their own based on what they've been told or what they know. So some of the behaviors that we see from children or the impact, it can be emotional. So we see difficulty in them bonding to their caregivers. The inability to trust. When we think about it, when we can't trust our primary caregivers for what's taking place and getting that explanation and knowing what's going to happen, who do you trust? So trust becomes a big factor. It's hard to trust, especially if they are also being a victim of the physical abuse as well. But we know the emotional abuse is taking place. We might see increased anger or fear from children. Behaviorally, we see, you know, the hyperactivity, impulsive behaviors. For children who are in a home where there's things taking place, the academics begin to suffer. And for a lot of children, when they're in school, what's on their mind is what's happening at home. So they can't focus on what their academics, they're focusing more on who's at home, who's watching younger children, who's, you know, is there substance abuse taking place, or is anybody being hurt? So it's hard to focus on their academics, and their academics start to suffer. We see oppositional defiance behaviors. And again, for children who are experiencing things, they're angry, and they don't understand why they're angry all the time, but they're angry, and they become more difficult to work with. And we know psychologically, we see things like anxiety, depression. And again, depression on children will look a little more like anger. There's those attachment disorders or disassociation. So, you know, with children with behaviors, a lot of times, unfortunately, they become labeled, especially in school, as those bad kids. But we need to, you know, it needs to go a step further. What is the root of what's causing these behaviors? Well, we don't always get there. We just label them as those bad children. So, you know, one of the things that we really try to do is, you know, teach caregivers, educators, anybody who's working with children is how to deal with these behaviors, how to recognize these behaviors and support the children with these behaviors. So education in these areas are really important when we're working with children. Next slide, please. So some of the trends that we've seen in the services that we're providing with our Child Advocacy Center, some of the things they've seen is younger children in the emergency rooms with more severe cases. And again, because of the isolation, some folks are seeking treatment when it's more severe, but not when smaller things are happening. So they go to emergency only when they have to. They've also seen less sexual assault examinations. There's been changes in the calls, in the consistency of the calls. In March, we saw a decrease, particularly with the Child Advocacy Center, where we do our forensic examinations. There was a big decrease in March, but you know, we kind of look at that as people were really learning how to adjust to this new isolation, to the shutdown, to their new way of life. Some people weren't working, trying to figure out how to make ends meet, so they weren't addressing things. And again, for a caregiver who's dealing with an intimate partner violence, sometimes the children, not in a purposeful way, but we see an increase in neglect towards children because they're trying to survive. But unfortunately, sometimes that impacts the care given to the children. But in April, we did see an increase in calls. So again, as people learned, and also as time went on and the isolation had gone on for a period of time, people had to learn how to respond to what was happening in the home. What are my resources? For some folks, this was a new thing to learn to reach out to get help. Because prior to the isolation, again, people would learn how to manage the situation. So they were probably getting by. But now that there was the isolation, they had to figure out different ways as time increased. When we think about the prevention that we were doing in schools, we have less interaction with children. So we have the less opportunities to interact with the children, provide those opportunities for education. We do some education in the schools, and we start with children as early as pre-K, learning how to keep themselves safe, recognizing what abuse is. When COVID came along, we lost those opportunities. For our trauma services, we went to telehealth. So that makes a change in the dynamic of the session. Depending on who's around the child when they're talking with their therapist, they can't necessarily talk like they want to or share like they want to. And the abuser may be in the room if there's a situation of abuse, or maybe they don't want to talk about the situation that's going on at home in front of the caregiver. So the dynamics changed in the delivery of services there. So as an agency, our response is to increase our educational opportunities for parents, caregivers, and those working with children. So again, we can help individuals work with children when they can lay eyes on them. We have less eyes on our children now because there's less opportunities in the community for children to be active in social settings. So helping folks understand what the behaviors are that we can see from children that are experiencing violence in the home, and how to support those children when they have those behavioral outbursts. So, we're increasing our opportunities, and we do have some trainings and webinars coming up. So, I encourage you to, look at the opportunities from anywhere to be able to learn more to support children. Next slide, please. So again, some of our responses to the interpartner violence for safety. We have our 24-hour helpline, and here it's listed, 391-HELP. We do have a shelter for emergency services. So it's there. I'm not going to read through them all, but I encourage you to reach out, share this number. We do have chat to text. So for victims, when they're not able to make that call, when they're not in a situation where they can make a call, they can text. Everything is private. They don't have to say who they are. If they don't want to, we just want to provide services and support and make sure that individuals are safe. We do have the domestic violence high-risk team. The coordinator of that team works for our agency, and we are working more closely with situations when they do present a higher risk. We also have an initiative engaging men and boys as allies, and that is an initiative to bring young men, boys, and men together to help change the attitudes and beliefs against gender-based violence. So again, educating, helping young people understand and how to respond to problems in the community with intimate partner violence. So at this time, I will turn the mic over to Ms. Dana Prince, Dr. Dana Prince.
Great, thank you so much. Okay, so I am going to speak particularly about the role of DV and IPV in a marginalized community, and that's the LGBTQ community. Although we are a small number nationally, we are disproportionately represented among those who experience domestic violence and IPV, and also our kids are in foster care at rates significantly higher than cisgender or heterosexual peers. So the National Intimate Partner and Sexual Violence Survey of 2015 found that 40% of lesbian women and nearly 60% of bisexual women report at least one lifetime physical abuse from an intimate partner, compared to 28% of heterosexual women. I think that those of you that work in domestic violence and IPV are probably familiar with the 1 in 4 statistic. That's based on cisgender women, typically heterosexual. So for lesbian and bisexual women, those numbers are at least two times higher. There's been a lot less research among transgender and gender nonconforming individuals. That research is just starting to be prioritized, I would say. One study that looked at a public safety net hospital, so individuals coming in for regular health screenings, found that transgender and gender nonconforming individuals were 5 times more likely than cisgender women to screen for domestic violence. 5 times more likely in a public safety net hospital.
Dr. Prince, excuse me for interrupting. Your sound is a little bit garbled. It wasn't when we talked right before the session. I don't know if there's anything different that's happened.
that help?
Yes, thank you.
Okay. So I'll just briefly say that what the statistics I presented are that domestic violence exposure is significantly higher, sometimes 2 to 3 times fold higher among sexual minorities, lesbian and bisexual women, and among transgender men and women. And that's an important point too, is transgender men are also screening positive for domestic violence along with their transgender women counterparts. So my other colleagues have talked about the co-occurrence of domestic violence and child maltreatment. The most recent estimates we have from national representative data show that the incident rate, so just looking sort of one point in time or a shorter period of time, show that about a third of cases where there's domestic violence also have child maltreatment. But the lifetime rates are even higher. So over half of children exposed to domestic violence are also victims of maltreatment. How's the sound? Okay, thumbs up for sound or thumbs down?
Thumbs down, Dana. Why don't you, can you try turning off your video maybe? Will that help with your connection?
Sometimes it does, yeah. Does that help?
It sounds better.
The challenges of working at home with COVID being enacted right now.
Exactly.
Yep. So Carrie talked a bit about how exposure to domestic violence and child maltreatment can co-occur and how they can impact earlier childhood development. There has been actually less research looking at adolescents around teen dating violence and the link from exposure to domestic violence and how that may impact teens and their dating relationships, and are they replicating these violent patterns in their relationships. I was involved in a meta-analysis of studies looking at that association. So does exposure to domestic violence influence teen dating violence behaviors? And what my colleagues and I found is that only 7 studies actually looked at victimization. And of those, 5 found a positive association. So a positive relationship between IPV exposure and being a victim of adolescent teen dating violence. But the other studies found no relationship or limited evidence. So we need more work in that area from a research perspective. More studies actually focus on perpetration. Okay, 16 studies looked at this area to say, if you are exposed to domestic violence, are you more likely to be a perpetrator of violence in your teen dating relationship? And here the evidence is also very, very mixed. There was some, around 3, that found relationships, some that found some relationship, but not a complete relationship, and others that found. And so really the terrain of research here is again, still pretty nascent, but we think from our practice experience and from theoretical work that exposure to domestic violence is indeed sort of this gateway to being in adults' IPV relationships, and looking at teen dating violence more may give us more information about how to intervene appropriately at that developmental stage to break the cycle there. The other thing that I want to point out about this body of work is that although sexual and gender minority youth, so those are young people that are LGBTQ, are more likely to experience child maltreatment, significantly more likely to experience child maltreatment and adverse childhood experiences compared to non, that they are basically missing from this adolescent and young adult dating literature. So we need more research that looks at these higher risk vulnerable groups, both in terms of their risk, but also in terms of resiliency and promoter protective factors. So as of June 15th of this year, there were just over 3,000 kids in foster care in Cuyahoga County. This is a roughly 250% increase from 6 months ago. Our numbers here in Cuyahoga County in terms of kids being removed from home and put into custody in foster care, those numbers have been steadily increasing over the past couple of years. About a third of these young people are adolescents, and more than 2/3 of them are Black or African American, showing the disproportionality around race in terms of foster care involvement. When I reached out to my colleagues at DCFS to ask for information for this presentation, getting information about calls to the child welfare hotline during COVID, which I think is interesting to this group. So the county, they receive about 40,000 calls a year through their child welfare hotline. And the percent of calls through the child welfare hotline that involved domestic violence or intimate partner violence during the first quarter, so that's January through March, so it captures right before and then just at the beginning of quarantine for COVID, was 15%. In the second quarter, so that would be quarantine through it's where we are now, that goes to 21%. So it ticked up. However, if you look back in time, we see that the annual percentage of calls to the hotline that involve TV are around 19%. That was 2018. In 2019, it was 17%. And so it's really not appropriate to make any kind of statement that there's been more calls related to DV because of COVID right now. We can't say that for certain. We need more data to show whether or not that was actually happening. We can say that in the last quarter, which is during COVID, we're looking at about 8,400 calls in this county that included DV or IPV as part of the call.
Dr. Prince, we're still having a little bit of feedback, so I'm going to share your slides on my screen just to see if maybe that will make a difference.
Okay, cool. Sounds good. I'll stop sharing.
Have you muted yourself, or are you able to continue now?
Okay, I was waiting for, all right, so here we go. All right, so I gave, so why then this overrepresentation in foster care? Estimates show between 15 to 19% of youth involved in the child welfare system are LGBTQ. And there's multiple reasons for this. LGBTQ youth are more likely, significantly more likely, 2 to 3 times more likely to be abused at home. They are more likely to run away. They are more likely to face rejection, in other words, to be kicked out because of their sexual orientation or their gender identity. Now, once sexual gender minority youth come into foster care, they're more likely to be in more placements. That means more homes. They're more likely to have more moves, and they're more likely to face rejection because of their sexual orientation or gender from foster parents, caseworkers, and other people that they come into contact with along the system. Okay. Can I have the next slide, please? So I conducted a community-based pilot study in collaboration with DCFS, the YWCA, A Place for Me, the LGBT Center of Greater Cleveland, Connect Ohio, and May Dugan Center, to understand more about what was happening around mental health, risk, and resilience for LGBTQ youth in our county who have been in foster care or who are currently in foster care. I'm going to talk a little bit about some of these findings, and I'm going to highlight in particular the role of intimate partner violence in this sample. The mean age here is 19 years. but it spans age 12 to 26. And I can tell you that even our young ones in this study were reporting intimate partner violence, or it would be dating violence, 12 and 13 and 14-year-olds. So the racial makeup of this study, it reflects the racial makeup of race disproportionality in Cuyahoga County. So 2/3 of this sample is Black, and youth identified a range of sexual orientations. Next slide, please. I also want to highlight half of the young people that are in this small pilot study identify as transgender or gender nonconforming. For those who aren't familiar, very briefly, gender identity refers to an individual's deeply felt and understood sense of self as man or masculine, woman or feminine, or another gender. And transgender is an umbrella term for individuals whose gender identity or expression is different from cultural norms about gender, specifically the cultural idea that one's gender aligns to one's sex assigned at birth, e.g. male or female. Next slide. So in this study, there's qualitative and quantitative data. One of the things that needs to be highlighted is that youth were facing rejection and harm at multiple touch points in the child welfare system, including comments, some of them I pulled out here from the study, made by foster parents, child welfare workers, and other youth in the system. Youth also described physical and sexual abuse within the child welfare system because of their sexual orientation or gender identity. Next slide. Suicide is a major public health concern for our young folks, our sexual gender minority young folks. In this sample, 70% reported suicidal ideation. I want to highlight for those of you that are looking at that issue of suicidality, the earliest ideation among some of these participants was 5 years old and carried on over time. 45% reported a past suicide attempt. In terms of homelessness, it's okay, next slide, you're good. 70% had been homeless. Importantly, just under 50% reported they ran away from a placement. A placement means a foster home provider, because it was abusive or not affirming of their sexual orientation or gender identity. I'll give you 2 examples of quotes. I ran away because my foster mother told me I was gonna go to hell because I liked the same sex. I ended up prostituting and selling drugs to survive. After a year being on the run, I got exhausted and called my social worker to turn myself in, and she promised to come alone, but she brought 6 cop cars and I was arrested. I felt like I was being locked up for my identity. I tried committing suicide a few times unsuccessfully. Next slide. In our sample, 65%, or roughly 23 out of 35 youth, met the clinical criteria for clinical depression, and 79%, or 28 out of the 35, met the criteria for clinical anxiety. Now, there's several factors that were associated with these elevated mood disorders and suicidality, including intimate partner violence. So let's move to the next slide. So intimate partner violence, we assessed with 5 questions and a lot of follow-ups to these questions. 1, my partner threatened to hurt me and I thought I might really get hurt. 2, my partner pushed, grabbed, or shook me. 3, my partner hit me. 4, my partner beat me up. And 5, my partner made me do sexual things when I didn't want to. In this total sample, 50% of youth positively endorsed at least one of these questions. So half of the young people had experienced at least one form of intimate partner violence, again, between the ages of 12 and 26. But nearly 40% of them, so of those, 40% endorsed 3 or more. Okay. Intimate partner violence, or in some cases here, teen dating violence, was then significantly associated with clinical depression and a range of suicidal behaviors, including suicidal ideation, planning, aborted attempt, and past attempt. It was also significantly associated with non-suicidal self-harm, for example, cutting or burning oneself. There were other things that were also related to negative mental health outcomes, but I wanted to highlight the IPV and teen dating violence, especially given what we've already said about how specific services for our kids are often absent, add-on, or thrown together by a worker who all of a sudden has a queer young person show up in their office and they think, oh my God, what am I going to do with this person? How do I address their needs? How are their needs different? Also within the context of IPV is happening along with all those other kinds of victimization experiences and rejection experiences that this particular group of young people is facing. Next slide. Which leads me to supports, right? Supports for our young people. And what does that look like now in COVID? On the positive side, all the youth reported having at least one supportive adult in their lives, and 100% of them were out about their sexual orientation or their gender identity to that support person. So what does that mean? That means that in order to really be considered a support, a true support to a sexual or gender minority youth, that youth has to tell you about themselves, about their whole selves. If they're not coming out to you, they probably don't trust you as a true supportive person. Now, sometimes that coming out process can take time. It's not a one-time thing. It can be building a relationship, but that's really important. If there's not a foundation there of trust and affirmation, the young person's not going to disclose and may not view you actually as truly supportive, even if you view yourself that way. And when we look at some of these associations, even in the small sample size, higher social support was associated with reduced suicidal planning. However, we also looked at strain in relationships, and this is an important point for us to think about as well. When we talk about supports and supportive adults and supportive natural mentors, we tend to look at the positive aspects of social support. However, we all know in our relationships with our people that we may think of as supportive, we also have conflict. Every relationship has some conflict. But what that conflict looks like and how the young person makes sense of that matters. So for youth who said, yes, I have supportive adults, and I believe that they support me in these ways. However, there's also a lot of strain in that relationship, meaning there are fights or times that I feel disappointed by this person. That actually was associated with increased suicidal planning. Next slide. So actually, sorry, next slide. I'm going to skip to this one. So I want to talk about then positive supports. And actually, I think Leah and Carrie are probably both on this webinar, which is great. Something that those of us who work in this space, okay, so those of us who work with LGBTQ youth in homelessness, in foster care, in community-based settings, we know that it's not enough to give a young person necessarily a hotline number or a general number. Doesn't work as well when we're trying to really engage LGBT young people who maybe have run away, who are experiencing different kinds of stressors and violence in their life. The best thing that we can actually provide is a safety net of people that we can individually refer young people to. So that's why I have this slide up here for all of you who are practitioners who maybe have a young person who either is in foster care or who aged out of foster care, who's experiencing homelessness, and you're trying to figure out how to navigate our current shelter system here in Cuyahoga County and don't know where to send a transgender woman, that you need to reach out to individual people who have knowledge and who are part of this community, who can help navigate those connections and be advocates along the way. So Leah Love works at Connect. She's a family advocate. She is implementing some very innovative connection-based kinds of interventions with families. So in a case where there's a young person experiencing conflict at home, how do we move caregivers from rejection into affirming and accepting behaviors? How do we keep kids in their biological family networks? and she's doing work in that area. So she's a great resource, and she can connect folks to other people. Carrie has been working in this realm for years. She's currently with NEOC. She's doing outreach to LGBTQ youth who are experiencing homelessness. She knows the systems here very well. She knows the shelter system. She knows the supportive services, and she knows how to advocate as a connector. And finally, Golnar is located at the LGBT Center and knows that community-based space really well. So I wanted to offer some people that can be connected to serve this population in the ways that we really, really need. And finally, last slide. I have to recognize all the partners in this work and say thank you and sorry for the sound difficulties. Thank you for bearing with me. And if there were portions of this talk that you weren't able to hear and you would like to know more, my information is on the bottom of the screen, my email, and I would be happy to connect offline. Okay, thank you.
Am I ready? Hello, I'm Alexandria Rudin, as you were told. I'm talking a little bit about a lot of things. I work in the family court context, and I'm a lawyer representing survivors of domestic violence, and through that, their children, because I help them get out of domestic violence situations. What we have found during COVID is, all I know is what is anecdotal. There is a higher incidence of child abuse and removal of children from families in the juvenile court context. In the family court, domestic relations court, private custody context, and civil protection order context, the hearings are happening remotely. Many survivors of domestic violence are happy about that because they do not have to confront their abuser one-on-one. On the other hand, that lack of contact is causing problems with many of the survivors of domestic violence. If they don't know their lawyer, they don't trust their lawyer. If they can't see their lawyer, they don't trust their lawyer. So next slide, please. That's COVID. Now, when I'm talking about policy considerations, I want to give you the historical context relative to domestic violence, children, parenting in family law. First of all, in 1991, Ohio enacted its statutory best interest factor where domestic violence was finally considered a best interest factor when you look at custody, visitation, and parenting plans. If there is a conviction for domestic violence or for any other crime causing harm and violence to a family or household member, that would mean that if the court were to award shared parenting or give that other parent contact, they would have to prepare written findings as to why that was in the best interest of the children. That we have. Then we move on to a case that came out of New York, and it addressed child welfare, and it was Nicholson versus Schubert. And in that case, many victims of domestic violence, women, lost their children, and child abuse was substantiated, not because they themselves committed domestic violence against their children, but because they were considered domestic violence victims. It was substantiated based on status. Okay, you're a DV victim, there must be DV, it must have impacted the kids, we're taking the kids. There was the case went to federal court and it was declared unconstitutional. The only way you remove a child from a battered mother, the non-offending parent, is you have to weigh what is happening to that child. It can't be a blanket, one size fits all. You weigh the resiliency of the child, you weigh what is happening with the violence, and then you look at it that way. Then we move on to enhancement of penalties. We've become so correct in how we deal that if there is somebody charged with domestic violence and it took place within sight or sound of a child, that would be an enhanced penalty. Unfortunately, many people don't remember that. It went into the statute in the late 90s, and I can't even tell you when the last time I ever heard that in a criminal case there was that enhanced penalty. But what we also now have is permitting child abuse on the books. And that means is if a child is killed or disfigured or hurt horribly by a parent, that other parent can be charged with permitting child abuse. So that's what's old. What's new is that in Cuyahoga County, there is a domestic violence department that it deals with both the parents, the lethality, but it also deals with the children. And because it's the same court that does divorces and custody cases, the thought is you can transition the knowledge to the same judges in the divorce case. Before that, you have a judge on a case, magistrate hears the case, there's a finding of domestic violence, that same family gets divorced, they go up to see the judge in the divorce case, and guess what? We're starting from scratch. So the hope is that as this department continues, we'll be able to make movement for the court in the normal custody cases. Additionally, House Bill 3, which has passed the House, has not passed the Senate yet, but that was Aisha's law, and that will address lethality, it will address child abuse, it will address the history of domestic violence, which is extremely important, and it specifically says that a child can be the target of domestic violence. House Bill 429, which is an amendment to the Address Confidentiality Program, which, good or bad, would allow a court under certain conditions or the other party to get the substitute address through the Secretary of State of a parent who is a participant in the program. Those are what's new. But let me just say, when we look at domestic violence, child abuse, intimate partner violence, what we're looking at is a problem. Because what is child abuse? Haley commented on that when she said under the DV statute, it is either physical abuse, sexual abuse, or committing child endangering, which is a substantial risk to the child. However, how that translates into a court setting and how that translates into case law is much more confusing. Here's what we know. The case law says parents have a right to correct the behavior of their children. Such punishment under case law must be, and this is the Supreme Court of Ohio, must be reasonable and it must be proper. What does that mean? For a young child, it could mean a bruise, but for an older child, it may be considered appropriate discipline. So we have child abuse, but what is also legal in Ohio is corporal punishment. So you've got a yin and a yang on when we deal with what is abuse. Adding to that, lawyers for victims of domestic violence continue to face a legal system where the violence is minimized or denied by those involved in the proceeding, and that could be the court, the other attorney, if they go to a family evaluation to determine which parent should get custody or both parents should share, and a guardian ad litem. So this is what we have. And any sympathy towards a survivor or calls accountability against a batterer in the criminal context easily turns to disdain or doubt or suspicion towards the survivor for even bringing up abuse allegations in the family court context. So this is what we have. If we can go to the next slide. So how do the parents look to the system? Next slide. You've got the abuser. Always attempts to present as the true victim. He can come into court, he can cry. This is terrible. I love my wife, but look what she's doing to me, to my children. That we get. They anger easily, and that's something to look for. If everything sounds good, and then the lawyer for the, let's say the mother says something, or the court says something, and that other parent gets angry, that's a red flag. They will claim that other parent is stupid and inflexible, but they are the epitome of flexibility. They appear vulnerable and attempt to engender sympathy with the court. And along with that, they attempt to create alliances with third parties. That is, they will hold the door for the judge. They will, I'm using that, that's a silly example, but I'm using that as an example. If the judge says something, they're forever going, oh yes, judge, yes. And so the court feels bonded. They will do the same thing with family evaluation, with the guardian. So then these third parties say, that person can't be so bad. Then they patronize the other parents. They can do that. They can patronize the court. But the most important thing they do, they minimize, they blame others for their inappropriate behavior. And they do not take accountability for what their behavior is. Now, turning up to the next slide, the abuse. One thing I think I have mentioned in many trainings is a perpetrator of domestic violence will lie more convincingly than a survivor of domestic violence tells the truth. What I mean, they may not be able to present, they may appear angry, they could appear anxious, unfocused, they could appear disinterested, unaffected, just numb. They could act aggressively or angry when testifying. Hello? Can you still hear me? Oh, is that yes?
Yes, we can still hear you.
Because it suddenly went dark. All right. They can act aggressive and angry when testifying. And when a mother especially acts angry, she is not considered a victim of domestic violence. She is discounted. She could also show signs of massive distress when she listens or he listens to the abuser's testimony. Next slide. So, faced with parenting decisions, what does that system do? It's not all bad, the system. Continue. So, if you look at the family court, you're looking at that perspective. Of course, we know that joint decision-making and equal access is best for both parents, and both parents should be involved in decision-making, but that's assuming no domestic violence. Problem becomes when one of those parents asks and demands, and I'm putting that in quotes, sole custody, or that same parent seeks to restrict another parent's access to the children, that is not seen as in the best interest of the children. In fact, that is seen as parental alienation, which has been a discredited aspect. But what we also have in Ohio as a best interest factor is a friendly parent provision. That parent who is more able to facilitate access of the children with the other parent. And of course, that will be the abuser. Of course, she'll be able to have her visitation or her parenting. Next slide. Then you say, for the system, who do you believe? You've got conflicting experts that talk about domestic violence and parental alienation. You've got the parents, he said, she said. You have some social service resources, but nothing on point for these cases in the family law context. So what to do? Does the non-offending parent try to protect the children? Does that parent, or what does the court do? Try to protect the children, refrain from violating the civil liberties of the abuser? Because if there's no conviction, how do we know? All we have is what she said. And, or do we worry about a potentially tragic outcome? The homicide of that survivor, or the death of the child at the hands of the abusive parent. And that is the court's dilemma. If you'll continue. So we have these assumptions in parenting decisions, that joint decision-making is always the best, that parental involvement is safe for both parents, that parents are always going to be child-focused if permitted this joint decision-making. And abuse to a parent is unrelated and does not impact children. Now, I've been a lawyer for almost 40 years. I've practiced only in domestic violence in family court. And here's what I've learned. I would go to court and I would ask that visitation be supervised, or that definitely we don't want an equal parenting or a shared parenting or joint custody. And the court would say, was there any abuse towards the children? And I would say the actual abuse was not directed at the children, but the children were exposed to domestic violence. The court said, no abuse to the kids, shared parenting. And there is a gap in how we need to address. One of the answers to that is to create a cadre of expert witnesses. And when I say, oh, boy, I have 5 minutes to tell you everything I was going to tell you. So I won't have those more than 5 minutes. So continue. We have these assumptions, and this is such a difficult issue. And what I've given you are some resources that address these assumptions. Next slide. Next, and again, next slide. And this is, abuse may be difficult to identify. These are other studies that address these issues. Continue. And then we have misconceptions about domestic violence. And then the following slide will give you the studies that address that. Next slide. Next slide. Okay, so now we have how to make sense of the allegations. We always need to convince a court to consider lethality. We need to have the court consider the context of both an incident and a threat. The court needs to observe the demeanor of both the victim and the abuser. And you have to consider the behavior of them in response to the questioning of the court or the other attorney on the stand. Okay, next slide. So, mother's demeanor matters. The mother who is hostile and there's DV is 5 times more likely to lose custody to the father. Even if there's a documentation of DV 5 times. And the severity and the type of violence is not predictive of the recommendations. However, next slide, the gender of the counselor or the guardian makes a difference. Next slide. So in the last, I'm going to give myself just a couple of minutes. Next slide, and hopefully you'll all get these slides. Next slide. The takeaways really is you always have to screen for DV. You need to identify who the primary physical aggressor is, and you need to look at a specialized assessment of DV risks based on who that victim is and who those children are and whether there are any protective factors. Next slide. In the next slides, which I won't have much time for, there's a whole new way of looking at this, and it's redefining domestic violence. Not all DV is the same. Sometimes it's in the past and it's been acknowledged. Sometimes it's isolated. I throw the keys at you. I have not done it in the past. We're in the middle of a divorce. It's been a stressful time. It hasn't happened before. It won't happen again, and it's been acknowledged. Okay, it could be reactive. A victim is responding to violence perpetrated against them. It could be ongoing and a history, maybe with coercive control. And then you've got that significant history, ongoing coercive control, and an attack on the children. So with that, courts have looked at what we have wanted courts to do, is look at these and say, no violence? Okay, no current violence? Okay, maybe shared parenting. Well, no current violence, they can't work together, or there has been some violence, maybe they can do co-parenting. If there has been ongoing abuse, threats, coercive control, then you may want supervised exchanges or supervised contact, or at least no shared parenting, because shared parenting also means shared control. And then if the abuse takes place with the children, then you think of no contact at all until that abusive parent does certain things. Continue. Again, I talk about when shared parenting should be considered. Next slide. When co-parenting, parallel parenting should be considered. And the most important takeaway with that is there must be clear boundaries. All right, it looks like I have to wrap up, they're telling me. So I am going to stop now, but you will get copies of the slides. And if you come into wherever my breakout room is, we can talk further. Thank you.
Thank you, and awesome job to each of you ladies. So now we're going to get into the question and answer part of the form. So I just want to let everyone know that because we're running a little bit behind, the panel will continue over past 11 in lieu of the breakouts that we're also going to have. So if you need to leave right now, you're welcome to do so, and thank you so much for attending. Okay. And so I don't see any questions and answers just yet that came through. So, Lisa, did you get any questions?
Not yet. People are welcome to add questions to the chat. But before we do that, perhaps we can ask the panelists if any of you would like to respond to one another's presentations. If there was information that you heard from each other that connects with your work, or that that you'd like to uplift.
I'd like to comment on Alexandria's presentation. So Alexandria pointed out that victims and abusers might not be acting in court the way you may expect. And particularly, we have this terrible stereotype of what is the perfect victim. So if you are a GAL or a custody evaluator or someone who's making decisions about children's custody, I just encourage you to kind of do that background work to make sure you're adjusting. Why do I think that survivor is legitimate while that one's not? Particularly when women victims are aggressive and then their credibility is discounted. I oftentimes see it when it's women of color, and we're getting into the angry Black women stereotype. So truly address that and be comfortable with what your first thought is, and then nip it in the bud.
I'd like to ask a question while we're waiting for our attendees to chime in. We see now that our pandemic is not going anywhere for a while. What do you all think? What's the landscape going to look like in these next several months? And what should providers be looking out for? How can they take action to help the situation for many of these families? Anyone?
All right, I know in the context of family court, everything is going to be remote. So it's hopefully verifying how, I represent low-income clients. Many of my clients only have a cell phone. They are not going to be able to do a Zoom hearing, a 5-hour hearing on a cell. So do we need to find resources to provide many of our clients, not just with Wi-Fi and bandwidth, but the actual computers, laptops, iPads for it? So I see problems there. Again, I also see problems with clients that don't know who their lawyer is and who don't know who the court is. And it's also going to change how lawyers do their business. Normally, we would meet in court, we would talk, you know, we go in, see the judge, then we come out and talk to our clients. Now, everything has to be done prior to having that Zoom hearing in court. So that's what I see. What I'm also hoping, and we don't know yet, the incidence of domestic violence. Is it going up? How much? We do know that from some of the pleadings and some of the petitions, at the very least, strangulation is increased. So that, of course, tells us we all have to learn about strangulation because we need to know how to address it.
So we do have a few questions coming in. So one is for Carrie. Has there been any changes with DVC-AC that they're implementing to handle the current situation? Do they have any specific changes they're doing?
We've had to, you know, adjust to be able to provide services. So with our visitation center, we are doing some of the visits remote. So it is done by video. So some of the, you know, we have recognized when the children are meeting with the family, you know, of course, because of the changes, their attention span is it's a little more difficult trying to do it remotely, but we are continuing those services. Again, we're doing more education through webinars so that we can help support individuals who still have that contact with children and with victims. Our justice system advocates are still working with victims in the courts. Again, everything is Zoom. So I wouldn't say that there's a lot of changes. We have just adjusted so we can continue to provide support for victims and survivors. Our support groups, we do have support groups that are virtual. So.
Okay, and then I'll see who wants to take this. We have one from one of our attendees, and the question is, I'm a school-based mental health counselor. How can schools support students and families who may be struggling with IPV and or have not shared this with school staff?
I'll jump in with that one, and Carrie, if I miss anything, I'd greatly appreciate your feedback as a prevention professional. So first of all, convincing administration to do education about intimate partner violence in the schools, that is developmentally appropriate. So the first thing I think of is JFSA's No Abuse program, where we go into schools and we've equipped teens to teach other teens about teen dating violence. And we have a middle school program as well to talk about what is teen dating violence, what is intimate partner violence. So kids can start to be like, well, maybe something that's going on at home isn't normal, it isn't okay. And then providing that, you can talk to your counselor about this, you can call this hotline about it. So one, just kind of pushing to provide that education. Particularly, it's more available right now over Zoom. There's more opportunities to do trainings for children who have internet access and phone access. And then in addition to that, talking to the children and a parent in a safe way. So before you say, is something going on at home? Saying, like, oh, like, who's around right now? Like, what's going on? To kind of suss out if it's safe to ask those questions, because we don't want children saying, dad's abusing mom, and then you get off the Zoom call and dad beats up kid because the kid just told on dad. We don't want to create unsafe situations. So trying to suss out for the safety and then handing it off to a victim advocate who, like like Carrie said, we're adjusting our services. So when I do telehealth appointments with a victim advocate, with a victim, we have a safe word for my abuser just walked into the room, get off the Zoom. Things like this, or like, I'm saying this word, so stop talking about that portion, because my abuser just thinks you're my counselor or you're in like a women's book club with me. So just referring out and getting that education in.
Thank you, Haley. Did you want to chime in on that, Carrie?
Basically, I was just going to agree with what she was saying. More education for school personnel. You know, a lot of times I think that personnel may think that that parent's just not engaged because they're not, you know, meeting with the faculty as often as they could or checking in on their child. But a lot of times there are things preventing them. There are barriers from preventing that. So just being able to recognize that it's not just a disinterested parent, but there's, you know, some other things going on in the home in a safe way, as Haley said, to address that.
Thank you, ladies. Another question. If IPV is about power and control and not subject to therapeutic interventions, is there essentially no intervention with the abuser that would work? Is the only answer to end the abusive relationship and keep kids away? How does one break the intergenerational transmission?
That's a big question. Go ahead, Dr. Prince.
I mean, that's a really big question. I think I don't think I can answer that full question, but it's a very good question. So in terms of the state of the evidence around interventions, there is a publication which I think I can pass on to Lisa to distribute to folks that I worked on with colleagues in the Mandel School. It's led by Dr. Megan Holmes, who's an expert in the area of domestic violence and the impact on children. And it's basically a review of the Green Book. For practitioners that are familiar, this is sort of the go-to guide for when there's co-occurrence of DV and child maltreatment. And we lay out in this paper, we lay out systematically the state of the evidence over the past 20 years. And it includes what is promising in terms of child welfare, which is the co-housing of DV and child welfare services, a lot of cross collaboration, and there's training, things like that. But it also lays out community-based interventions, like Safe Starts is one of those community-based interventions. Some of the parenting programs that are implemented in child welfare that have been tested in intervention trials. We need more evidence to show how they work, but multi-systemic therapy, different parent-child kind of interventions. And then there is a section on batterer intervention programs. And so that is an area, right, where another colleague in Mandel School, Dr. Laura Voigt, works in this area. And there's a review of batterer intervention programs and how the limitations around the evidence, looking at those interventions, but some of the promise as well. So I think, you know, because we don't, I referenced the Green Book. It's called the Green Book because it has a green cover, okay? So that's why child welfare workers call it the Green Book. And it is the guide on what to do with a case where there's co-occurrence of domestic violence and child maltreatment. This is, again, I'm speaking from a child welfare perspective. I'm not speaking from a community-based organization or advocacy kind of perspective. So I think I can forward that paper. I think other people probably have ideas around this, but the idea that you can work with men and boys around transformation is a pretty important idea, and one that many of my colleagues are more versed in that than I am.
And adding what on to Dr. Prince said, the battering intervention program. So the book I suggested, The Why Does He Do That by Lundy Bancroft. Lundy Bancroft's a battering intervention counselor. And when I say therapy is not effective at getting abusive people to not be abusive, what I mean is normal talk therapy, where the only thing the therapist knows is what the client gives you. So the client's going to give you information of like this, and they're not going to say, hey, I'm abusing my partner. How do I not become abusive? Because it's from their perspective. Battery intervention counseling is that mixed methodology that Dr. Prince said of the individual therapy, but group therapy with other abusers, so someone can start to take responsibility. And what I say is, if you are a child professional, and acknowledging that it's a power control issue versus a mental health or substance use issue, what I mean is, don't just refer the offending parent to anger management. One, because anger management makes it worse, so just don't do that. But also therapy and substance use, that might address a mental health or substance use problem, but it's not going to meaningfully address the abuse. And that means it's not going to meaningfully make things better for the child. So I think it's possible for everybody to become better and not be abusive. And I believe in like the ability for humans to improve, but just that involves really taking responsibility. So I hope that answered your question and didn't confuse things more.
And I wanted to just add, you want the system to understand what's going on and understand the dynamics, because it's the system that's going to hold these abusers accountable. We need better batterers intervention. We need programs. We have one batterers intervention program in Cuyahoga County, the diet program. So we need them. We also need more resources for abusers. Like we have a family justice center for victims of all these crimes. We need one for abusers where they can get all their services in one place. And we need more community supports. So that means people, if we have that education, then we have people in the community, at the church, at the, I don't know, pick a place. You have people saying, no, this is not acceptable. And the hope is you change behavior that way. But the only thing that is going to make a batter a good parent at all, and this is from Lundy Bancroft, is owning it, showing remorse, and knowing what can we do to become better ourselves.
Thank you, ladies, for sharing your perspective on that question. So now we're going to have one last question that we're going to take. And the question was, what has your experience or the current research shown in the area of children growing up in abuse and propagating abuse later in life when they have children?
Well, again, from what I've seen and from the work that I've done, you know, unfortunately, if children don't learn better, they can't do better. So again, the environment that they're in, they're going to learn different behaviors. So it is about helping children understand and change the attitudes and beliefs against gender-based violence and violence in general. So it's not that they can't change, it's that there has to be the mechanism there to help them recognize, and again, that accountability piece. So without learning something new, there are great chances that, you know, there will be that the transmission of these behaviors. But by learning something new, it doesn't mean that they're going to be abusive. And sometimes we do have people just, you know, based on what they've learned, they can recognize that this is not okay. And it doesn't mean they're going to necessarily be an abuser because they were in that environment. But it is around learning something new.
Can I just add, just one thing. I think it also depends on where the protective factors are for that child. If a child grows up in a nurturing home, that child and the parent is able to address their issues, then they may be okay. Then you've got others that one incident is going to create all kinds of problems, and they're going to grow up and they're going to perpetrate the same abuse.
Mm-hmm.
Awesome job, ladies. So now we're going to share our closing remarks. I just wanted to thank everyone for joining this important conversation. We are especially grateful for each of our panelists, Haley, Alexandria, Dr. Dana, and Carrie, and Lisa for also helping us out with this conversation. We appreciate your sharing your thoughts and your passionate remarks, and for the meaningful work that you've each done through your careers on behalf of children and families. Let's see. And so for those of you interested in additional training, the DVCAC will be offering a virtual workshop on July 31st. Carrie, will you share some brief details about that?
Yeah, so this workshop is just going to be, we're going to talk about what, I'm sorry, I'm getting my workshops confused. I just did one the other day. So this will be about the impact of violence on children, what family violence looks like. So we're going to talk about what that does look like, what some interventions are, how the behaviors you'll see from children, and support that can be given to families.
Thank you for sharing that. And thanks again to JFSA and DVCAC and the Schubert Center for Children's Studies. This concludes the formal portion of our webinar. Our panelists will be available in breakout rooms for dialogue and conversation for the next 15 to possible 20 minutes. If you would like to participate and be sent to one of those rooms, we invite you to remain online. If you are interested in meeting with a specific panelist, please indicate your preference in the chat. Otherwise, we will assign you to a room. Thank you, and everyone have a great day and stay safe.
Actually, Natasha, thank you so much for moderating today. We actually, because of our timing now, we've just done the Q&A in the time that was allotted for the breakout room. So we want to thank all of you, again, the panelists, and those of you who attended. And we'll be sending out all the information and resources later today, along with the evaluation. So thank you again, and we hope everyone takes care and has a safe and pleasant day.
Thank you.